Hey everyone, this is Dr. J with Dental Masters of Alexandria, and aging affects every part of our body, including our teeth and our gums. Understanding the changes that take place throughout your life can help you maintain good oral health as you start to age and these changes take place. Here's part 1 of our 5-part series in the life cycle of your teeth. I'm not a TV personality or a movie star, I'm a dentist, so I may occasionally look down at my notes. So here we go. Part 1 is childhood. It's basically from age 0 to 12. And some of the main phases. First is primary teeth eruption. So this is when infants are typically born without teeth for the most part. And around 6 months, the primary teeth or baby teeth start to come in. They start to erupt. We use that word in dentistry. And this process is known as teething. You may have seen this and you probably know about it if you've had infants, because the children and the babies start to cry, they get uncomfortable. We give them pacifiers. Sometimes they need soothies and other things like that to feel more comfortable. So this phase continues to about age 3. And again, these are all center of the bell curve or average. So some of these ages, they may go one way or the other. The second part we call mixed dentition. And why is that? Because we have some baby teeth and some permanent teeth. And so there's a couple things about this phase. It happens around age 6, and typically the first tooth that comes in sometimes is what we call the 6-year-old molar. That's your first permanent back tooth. We call it the 6-year molar because it comes in around age 6. And this tooth actually does not replace a baby tooth. It comes in behind them. The baby teeth molars are actually the space holders for your premolars, or the ones in front of your molars. So this phase again is mixed dentition. Typically it goes through age 12 with the exception of the wisdom teeth. Pretty much all teeth are in up to the second molar. And the other thing is, as teeth are shifting and moving and your child is trying to find their bite, how their teeth fit together, you might hear them clenching their teeth. Some people will clench their teeth separately of this as a neurologic habit called bruxism, which is separate. Most kids will clench or squeeze on their teeth to try to find their bite as things are changing, and then as we get past that, it will stabilize and go away. So the other thing about this phase that is really important to know is that dental caries is the disease that causes cavities. It's common for children in ages 0 to 12 for a couple reasons. Typically there's a higher sugar intake, and usually there's poor brushing habits. So a couple things is you want regular dental checkups. I did a video a while back called the crib being a no bottle zone, meaning no bottles of anything to drink for your infants in the crib, because that gives them access to sugary beverages all night long, and exposure time on the teeth is more detrimental to get to the teeth having cavities. And the other thing is, a lot of these teeth that are first forming, they're at their most anatomic, or they're most like a mountain range, meaning the teeth are most pointy and groovy, and these grooves are where we typically get cavities as children. So just kind of be aware of that. All right guys, thank you so much for tuning into part 1 of the life cycle of your teeth, and I'll see you next time for part 2. Have a great day.